the incidence of the Waldenström in the Western population and the Eastern population is dramatically different. I think there's a 20 or high incidence in the Western population compared to the Eastern. So we saw that there should be some reasons for this. For example, the antigen stimulation or some cytogenetic aberration between the difference between the Western and the Eastern population, Waldenström patients. So we do some examination from the karyotype, the cytogenetic aberration, and the fish examination to detect the chromosome aberrations. And we also examine the gene mutations, such as the MYD88 mutation and CSF4 gene mutations. We hope that we can, from this level, from this aspect, we can get some difference. And also, as we know, Waldenström is a B-cell lymphoma. So we think that the IHV fragment usage maybe is another aspect to detect the difference, to compare the difference between the Western and the Eastern population. So we found this 4 aspects to do some work. And because the chromosome, the karyotype, the proliferation of the Waldenström cells is very low, so we can't get enough information to detect this kind of difference. So we think that the difference between in this aspect is not so obvious between the Western and the Eastern population. But from the fish examination, for example, we use 5 probes to detect, for example, TP53, ATM, and MYB, and others, transform 12. The incidence of this aberration is also very low. I think the MYB, that means 6q deletions. That's a high incidence in this Waldenström patients. The incidence in our test is also not so high. I think in the Western reports, the incidence is about 40%, but in our study, we only show 25%. So it's very low. But we know for this fish, we didn't use the sorted cells. We just used all of the MNC cells. So not all of the patients have really detectable for these aberrations. So I think the technique problems maybe also will make the difference between the Western and the Eastern reports. And from the MYD88 mutations, I think previously we used the single sequencing method. We detect that only 6 to 70% patients have this mutation. So we just sometimes some days ago we think that this is maybe the difference between the Western and Eastern. But we using the next generation sequencing technicians and the ddPCR method, we can increase the incidence to 87%. So I think the difference is become small. So for this aspect, we don't think that there is any difference between the Eastern and the Western population. Another aspect is about the IHV fragment usage. In this study, we detect that the usage of the IHV4 segment is high in our study including 133 patients. So this is the largest cohort in this aspect of study. So we think that the usage, IHV fragment usage may be different, and especially for the IHV 4234 fragment usage is very high. It's occupy more than 10%, I remember. So that's is very rare in the Western reports. So I think that's the antigen stimulation. Maybe the main difference between the Eastern and Western population. I think we've just found that this difference between aspects of the genomic aberrations. in our population. Thank you.